Welcome to Health is Wealth with Dr. Mike. I'm Station Manager Tina Cortez, and my co-host is Dr. Mike Carrozza. Good morning, Dr. Mike.
Good morning, Tina.
Now, at this time of year especially, it seems very difficult for people who suffer from anxiety and depression. Do you find that in your office?
I'm finding this right now more common than any other illness right now in my practice.
And why is it especially difficult at this time of year, do you think?
Well, I think that everybody is, I think society just demands a little bit more from us at this time of year, for sure. It's definitely the hustle, the bustle. We're trying to close things off for the year end. So it's from a business standpoint, you want to make sure everything's in check for your operations. From a familial standpoint, you want to make sure everything's under the, you have all those Christmas wish lists all checked off. And then from the entire health standpoint, not everybody is eating the healthiest. And so this is predominantly the cause of some of these issues.
So we're talking about anxiety and depression specifically, and you're suggesting that diet also has an impact.
Well, we made the connection in our last show, in our last two shows. We talked about leaky gut,
leaky brain.
And that was a huge segment because we made that connection. Hence why we wanted to just tie this into the mental health segment. So this show is dedicated to mental health, predominantly talking about anxiety and depression. Now, I don't like to talk too much about this depression because it's somewhat overdiagnosed today in society, because a lot of people come in and this like, oh, I feel depressed. Listen, you're having a bad day. I think calling it depression is really, really difficult, and it's something really harsh to just go right off the bat. We're going to talk a little bit more about this with a good dear friend of mine who's going to be on this show, and Dr. Michelle Paris in a bit. But most importantly, I think anxiety right now, and there's different phases of anxiety. There's mild to moderate, and then we have severe. And so what we're seeing right now is we're seeing people have difficulty sleeping. Mm-hmm. And this is attributed to a lot of stress. And in our next segment, we're going to talk about stress being the root cause of a lot of issues. But how we're going to tie this in is leaky gut, leaky brain, because diet and nutrition will actually help facilitate some of our neurological pathways. And it's going to help with our body and our brain in terms of thinking and in terms of helping us troubleshoot and getting out of these difficult situations.
Now, you mentioned anxiety in terms of being mild or much more severe. How do you determine or diagnose where your patient lies in that spectrum?
I love that. I love that you're asking that, Tina, because that's really important. It's something that I take pride in my practice, because when patients come in and I understand that this is an anxiety case, they're coming in, they're like, oh my God, my stomach hurts. I don't know why. I'm getting heart palpitations, ringing in the ears. I get really nervous. Anxiety, just so you know, Tina, a lot of emergency rooms have a hard time diagnosing a person having a heart attack or having just a panic attack, because some of the symptoms are similar. So when a patient comes in, we have to make this distinction. So when they come in, I like to use something called a Beck's anxiety scale. It's an inventory which is pretty well documented in terms of the research, and it's something that we like to score. So we make our patients fill out a quick questionnaire, and it'll gauge them, and between numbers of like 1 to 5, they'll gauge sort of their symptoms. So it'll say like heart racing, do you have heart palpitations? Do you profusely sweat? Do you have difficulty sleeping? And you'll gauge it between 1 being like a low symptom score and 3 being a little higher. So that number, and then we calculate that total. So like if it's a total of like 20 to 21, it's more of a moderate. If it's higher than 21, then it's more severe. And I'll tell you this, I had a patient come into my office, and he kept coming in every week, and he said, I don't know what's going on. I don't feel right. And I said, well, what's wrong? And he says, I don't know, like my heart, like, I don't know. I just don't feel right. I think maybe I pushed too much at the gym or something's going on. And I said, okay, I took his blood pressure. I said, listen, you're fine. Your pulse is good. Everything looks like it's in working order. You're good. And he's a young man, 25-year-old male, who's quite active, working out 6 days a week. And I said, listen, it's most likely not a heart issue, but what's going on? Anyway, so he started talking to me a little bit about his diet and his nutrition in terms of lacking. Anyhow, so he was coming in every week. Once I did a Beck's anxiety scale score on him, and I had him fill out the questionnaire, we found that he actually had moderate anxiety. And when he found out that he had anxiety, there was like a calming effect. He's like, oh, That's all it is. And so it's like, look, you have anxiety. This is the issue. And you're probably just panicking because of the anxiety. And he was crying in my office and he came to me and he was very sad. He's like, listen, I don't want to die. I just feel like if I go to sleep, I'm going to die. And I was like, okay, I felt for the patient. I said, look, listen, this is what we can do. So we put him on a nice little protocol and, he's so much better. And he's doing really well, but it's almost like understanding that you're living with this, that this is something that it's okay. So there's a lot of patients that are suffering with this, and understanding that you actually have some form of anxiety is not so bad.
Now, this came on suddenly for this 25-year-old, or maybe not. Maybe this is the first time he recognized it in himself. Do you find that there is sort of an age range, or does it affect male or female more? What are some of the stats on this?
I'm seeing it more in youngsters today. I'm seeing it a lot in youngsters, more so than ever. And so we have to screen our patients, and we have to make sure, they're not consuming some narcotics or just doing some, because there are triggers, right?
Triggers.
So alcohol, things like alcohol, chocolate, and a poor diet, and of course, drug use will actually trigger this, and even marijuana use, which is actually becoming a problem now.
Now, in this specific case, you said this 25-year-old said, "Oh, well, is that all it is?" It shouldn't be easily dismissed, though, either, right?
No, it shouldn't be easily dismissed, but it's like, listen, everybody has anxiety, and so if you have it, then you can take the actions and the appropriate actions to sort of help this, and I think that's the key.
When we come back, advice to help us manage our stress and anxiety. This is Health is Wealth on 105.9 The Region. Stay with us. You're listening to 105.9 The Region, and welcome back to Health is Wealth with Dr. Mike. I'm Tina Cortez, and our focus today is mental health and what are the causes and how meditation and diet can help.
Tina, I'm going to invite somebody to help me talk a little bit to point on this huge area. And I'd like to welcome Dr. Michelle Paris. She's clinic director of the Poppy Clinic in Oakville and Rebel Tribe facilitator. We'll talk a little bit about Rebel Tribe, but she's pretty much a superwoman in this and having a huge impact on our profession in a positive way by supporting things like community approach and group therapy, which is a big, and we'll talk about that, Tina. This is a big, there's like a resurgence right now in medicine. I think right now community care and this group therapy is huge. I'm proud to call her my friend and dear esteemed colleague. Welcome, Dr. Michelle Paris. Thank you for coming on the show.
Thank you so much for having me. I'm really excited.
So, we were just talking earlier with Tina. We were talking about mental health, of course. And, I just, she asked me an important question about how many patients do I see in terms of anxiety. Now, I wanted to ask another practitioner because I don't want to be the only one in the room to say, hey, this is something we're seeing a little bit more commonly. What are your thoughts? And how many patients would you say have anxiety and are coming into your practice?
Yeah, it's a huge part of my population. And I do work in, perinatal and postpartum care with women and women of all ages. But I remember in my early years being shocked at how many times I was putting anxiety, general anxiety, depression in my assessment for my patients. It's a very large amount of my patient population that I am seeing that these mental health concerns are there.
And it's growing?
Yeah, I think it is growing. And I think the research would lend to that's true. But yeah, I think my entire career I've been shocked by the level of anxiety and depression that I see in clinical practice.
And I don't even know if it's growing. I think more it's patients who are more accepting it,
more aware of it, more accepting.
There's more
destigmatized.
Correct.
Yes.
Yeah, that's a good point. And I think patients are knowing that they're having this and they're recognizing it now. Dr. Paris, maybe you can explain to some of our listeners a little bit about what you do, because it's really unique about the community and sort of group therapy at your clinic. I want to really talk about that and showcase that because it's something that I always wanted to do, and you're actually doing it. So kudos, and maybe you can tell some of our listeners what's going on with that.
Thank you so much for saying that. 3 years ago in my clinical practice, I opened my own practice and I made space for community. And I knew it was a real risk because it's hard to get people to show up in a community group. But why I think this is such a relevant topic for what I'm doing is that there were so many women in my practice that I could tell had really outgrown the need for one-on-one care, but the anxiety and the loneliness was still so apparent. And so I really used that and was looking at the data that was being published at an astronomical rate. There was a study that caught my attention that said social isolation is the leading all-cause mortality. It's more harmful than cigarette smoking, it's more harmful than drinking 6 alcoholic beverages per day.
Wow. Yeah.
It's equal to 15 cigarettes. It can shorten your life expectancy by 8 years. To me, it was like, we need to be screaming this from the rooftop. And, listening to what you were saying before, it is our younger population that is lonelier, is experiencing more anxiety. Exactly. It is growing. And so I really felt I had to find a solution for the women in my practice. And so I created a 10-month curriculum called Rebel Tribe, and it's a closed group, and we meet for 2 hours once a month. And the lens that I put on it was, let's hang out, let's create community for you women so that you have, the strength to adapt these health changes, because it can be a bit scary to be the alien who's gluten-free alone, or right? You feel like you don't fit in with your family or your friends anymore. So I thought, well, let's put all these aliens together and see what happens.
So what happened?
Transformation. So the most beautiful thing was, yes, they learned about their health, but we had real high quality conversations and we got real. We really had that human experience. We connected in a very profound way, which I think lended by hanging out for 10 months together. And not only did these women adopt all the healthcare and lifestyle changes that we cared about, they started to really step into their power and transform their health and really get honest about what lights them up and being brave enough to take action on that. So, quitting the job that wasn't lighting them up, deepening their relationships or leaving partnerships or friendships that were no longer serving them. These women got really brave, and it was the most beautiful transformation to witness. And that's when I really started to believe that this group health is where we need to be hanging out, because we can help a lot of people and have a big impact, and not, because it's hard to do a one-on-one practice all the time. At some point you get too busy.
Oh yeah, and then you just can't see everybody. I mean, I think so this is the new
group
wave.
Therapy?
This is the new wave of medicine, though, Tina. This is actually the new wave of functional medicine and actually getting people well. Mm-hmm. When we're talking about wellness, and there's some huge data, and I think Dr. Paris will mention this. There's some huge data about like group therapy and how one another can lend each other a helping hand because they've gone through an experience. I mean, we've seen this with, addiction and mental health, and in this group settings and whatnot. But in terms of medicine, I mean, she started this 3 years ago. This is like so hot right now in the U.S. And I gotta say, congratulations to starting something so long ago, and now we're seeing it so used, worldwide. And so I think the idea is, that conversation, that connection between somebody who has something similar and is going through something similar. When we talk about mental health, it's like, yeah, you're not the alien in the room. You're not the only one that has this. Other people do, right?
Mm-hmm. Well, we were talking about this a few minutes before, is that, we get patterned in our thinking, which is when anxiety and depression can start to really increase. And when you start hanging out with people who have similar stories, but they took that difficult moment or challenge, but they turned that into their power, they found a way to innovate, that gives you instantaneous permission to believe that something else is possible. So do they really have clinical depression, or were they stuck in patterned thinking and didn't know that there was another way?
And how do you find that other way? How do you get out of that pattern or that rhythm that you're in so that you can find that new path?
Well, for me, you hang out with other people, like-minded individuals. To me, it has so little to do with me as the facilitator. It has to do with that community is the medicine. Hanging out and listening to wisdom. Someone said to me, like, circles are evolutionarily obvious. When we hang out and we gather information from each other, you learn that there are different ways. And I think this is where we're going wrong, is that we are wired for connection and we just put people together. There's wisdom in that, and there is permission to find different ways. The amount of times that I've been healed from something, from a single sentence, and someone said something profound, and I'm like, oh, I have permission to think a different way. it's transformative, right? So I think we hang out together. I think it's so much easier than we're giving it
And
credit
Dr.
for.
Pierce, have you had any of these groups where the dynamic doesn't work and that maybe they're not connecting? Then what do you do?
It's a challenge. I've had moments of challenge, much more positive than challenge, but that's a unique challenge to facilitate and support. And so it's really, there's usually someone who's really patterned in their thinking, and they can bring a certain energy into the room that makes it challenging for others to connect. And so I think I've sought help and support from other people who've maybe been doing this longer than me to know how to navigate those waters and help still ensure that other people get connection out of this, despite someone being having a tough time.
Sure.
So I think I think medicine today just wants to transform individuals and sort of put them and fit them in a box. And then what's wrong with that is that these individuals are not getting showcased in terms of what their true potential could potentially be. And so when they're in a group setting and they see somebody else who's actually exhibited and actually went through something that they're actually going through right now, because a lot of people don't want to talk about this. And they're like, what? You felt like that too? Like, you talked about postpartum, and I know what this is like because my wife, I went through this with her. Like, it's dark. And I know you have a couple of kids too. Like, and I've seen some patients around this, and that postpartum depression, that D word that we hate talking about, but it's pretty dark and gloomy. Mm-hmm. It's like, but it's real. It's like, what? You just felt like you didn't want to live anymore? And it's like when you converse with somebody else and they felt this as well, it actually says, oh, I wasn't alone. Well, how did you deal with it? And so, yeah, I think it's important. I think it brings merit to medicine, and I think it's a new wave. Truly it is.
Mm-hmm. And to connect that to what you had just asked, connection is a scary thing for a lot of people because there's, pre-existing trauma where connection wasn't safe. And those are the people that usually get challenged throughout the community setting. And so, pouring more love and acceptance onto those people can really help foster that. And, a lot of times when we're stuck in depression, that's where we see those things come up in a collective.
Exactly. And in terms of like symptoms, let's get right into sort of symptomology. I mean, we don't like talking about this, but, the symptoms of patients coming in with things like anxiety. We talked a little bit about it early on in the segment.
Yeah, you mentioned insomnia.
Yeah, we mentioned insomnia and that idea of worry or fear. People will have some shortness of breath. They'll have that chest pain, as we mentioned, right, Dr. Paris? I mean, some people could actually diagnose this or equate it to like a panic disorder and like almost like a heart attack, right? Because they'll feel their heart pounding out of their chest, or they'll just feel like something's not right. And then that fight or flight state, which we talked about prior to this segment, we actually made that connection. Her and I just mentioned briefly, and I think we'll talk to our listeners about this fight or flight state, right? That's that.
Yeah, elaborate a bit on that.
Yeah, I think it's important. It's that sympathetic nervous system. It's that, because stress is the root cause of a lot of, especially during the holidays, what we talk about here. And I think that our sympathetic nervous system always firing, that adrenaline, that cortisol that always gets in our blood and in our bodies, actually creates an acidic environment. Mm-hmm. And we know this. And we know this acidic environment is toxic, and it's toxic to our bodies. And so, engaging in that parasympathetic nervous system is something that will actually heal and help these individuals. And however that's going to be, I mean, they'll be in a group therapy session and they'll talk about ways in which somebody else did it. And this mindfulness, this topic of mindfulness, this meditation that will actually bring people into that setting to sort of help them cope. And these are coping mechanisms. And so some people will have adopt these. And there are individuals that actually know how to do this very well. And those might be one or two in your groups of like 20 or 30 that you mentioned. But, and you have that one person that said, look, I navigated this water. This is how I did it. Mm-hmm. And so maybe you can elaborate a little bit on that in terms of how patients can get through that sympathetic and that parasympathetic state so that they can become less acidic.
Well, what really opened my eyes about this state is, one, the society we live in, we have a lot of stress and we are not very good at shutting off, and we don't really celebrate the downtime, right? So we like grind and hustle. And so we stay in this fight or flight cortisol stress response. And bringing it back to how we're wired for connection, our brain experiences physical pain equal to social pain. So the confusing part for our brain is that historically it was the saber-toothed tiger that caused this fight or flight response. There's no more saber-toothed tigers, but there is stressful situations that put us in this fight or flight. And what this does to our body, when our brain thinks it can be perceived stress or actual stress, doesn't even actually have to happen, but you perceived the event as stressful.
Yes.
You get this cascading effect in your physiology, so that your adrenal glands kick up that cortisol, you increase your adrenaline and norepinephrine, and you have this like panic response. And what that does in our bodies, it actually increases inflammation. And so there's some studies done in UCLA that's looked at how social stress increases our inflammation, which increases our anxiety. And the more you do that cycle, so say you're patterned and you keep thinking about those anxious moments, it eventually leads to depression. And so what my theory is about how circles are supporting and healing this is that there is this whole limbic brain, neocortex, limbic brain thing happening. It is safe in a community. If you create a safe space, for the first time, an individual can feel what rest and digest feels like. Because if we live in this stress response state all the time, we forget what it feels like to be in rest and digest. I've burnt myself out. I can attest, even knowing all this information, I've forgotten what that feeling is. And so if you can hang out and create a safe space, for the first time, people can calm down and down-regulate that response and hear what you're saying, right? And then you can root that in the emotion. So I always bring it back to connection, because there's this natural healing mechanism. I think as naturopathic doctors, we also can do talk a lot about lifestyle and nutrition and how we can facilitate getting people out of this state, because it's this state that can be particularly damaging and precipitate mental health concerns.
And I think, that's the key, because we're all going to get stressed, Tina. I mean, stress is among us, and it's there. And it's, it's okay to get stressed, but it's that continued state of stress that actually can cause the problem. And it's turning this signal off. And if we can use these mechanisms to turn these signals off so that we're not continued in that stressful state. And these are some of the points that we've just put forth, and that's, that restful, that parasympathetic nervous system, like meditation, like people who meditate actually have a larger brain. They have a larger portion in their brain, the corpus callosum, which actually controls this center. It's actually well documented, and you'll see the research because it's there. I mean, the idea is, these individuals have a better connection, and they can actually have that restfulness and that parasympathetic that'll stimulate things like serotonergic pathways so that they'll feel better. And, I think some of the big research studies are on things like cognitive behavioral therapy and antidepressants. And so CBT, cognitive behavioral therapy, actually wins, because that mindfulness that causes the patient to actually tune in, and they're able to turn off, to tap into that parasympathetic nervous system, that rest and relaxation state more frequently on their own, is how they're going to get better.
Are there also vitamins and supplements that could help?
So I think the idea is, and Dr. Paris will help me with this as well, in terms of causes, there are nutritional deficiencies. Don't get me wrong. This is going to be important. There are nutritional deficiencies that will actually give rise to causing individuals to have a predisposition to some of these issues, for sure. And I should make a note of this. I think anxiety in general is predominantly hereditary. So it is, if somebody in your family, maybe your mom or your dad, had it, most likely you're going to have it too. But if you look at this from a nutritional standpoint, it could be as easy as a nutritional deficiency. And so we're going to talk about some nutrients and vitamins that we love. And so B vitamins, and like B3 especially, and B12, which you and I both love. And then omega-3 fatty acid deficiencies are huge, because that part of our brain actually predominantly, and we talk about this in our show, how omega-3s are, build up about 40% of our brain. And so we want to have that neurological, those neurons firing, right? And we want to have that fatty connection in our brain. And in terms of treatment, there's a couple of sides of this. So there's dietary treatments and there's things to avoid. And we talk about coffee, chocolate, and alcohol and stimulants, which are going to make things worse, right, Dr. Paris?
100%. Like sometimes it's as simple as removing coffee and someone's anxiety is completely gone.
Completely gone.
No one's told me that.
Yeah.
It's so simple sometimes.
And how many calls I have in my office, I can't tell you about, especially around this time of year, saying, I need to talk to Dr. Mike. I'm having an issue today at work. My chest is palpitating. Should I go to the hospital? And so I would call the patient back, obviously between my patient visits, and I would call the patient back and say, what's going on? And they're like, I don't know. Like, I feel racy, my heart, I don't know what's happening. I says, well, what did you do today? What did you do different than yesterday? Well, I had 6 cups of espressos.
Okay.
And it's
so there's a trigger there.
And it's like, but that some of these people just can't genetically, they're not genetically labeled to have this. Like, so their predisposition won't allow them to sort of metabolize the caffeine. We know this through genetics and epigenetics. And so this is some of those individuals. So things like alcohol, coffee, just sort of make things worse. And that's what we talk about around the holidays. Who doesn't like a Java, and who doesn't like an extra drink around the Christmas holidays?
For sure.
So in terms of things to avoid, we want to talk about things like processed foods, right?
Mm-hmm.
So less processed food, more nutrient dense. And of course, you want to consume a little bit more fruits and veggies, and then wild fish. But in terms of vitamins, let's get right in it. What's your favorite, Dr. Paris? What's one of your favorite supplements for anxiety?
Anxiety, my favorites are GABA and glycine.
Great ones, because that'll help with the sympathetic and just helping the patient and turning that cortisol and that pathway off. I mean, my favorite is I love Passiflora, which we love as well, and things like magnesium, which are really good.
Magnesium's a fantastic one.
Chamomile tea is something, if you're ever in a jam, instead of having that extra coffee, maybe turn to a nice chamomile tea to be more calming. And then ashwagandha, which is huge. But I mean, all the ashwagandha in the world is not going to turn off the cortisol, right, Dr. Paris?
Yeah, we were laughing about this because that's what I love about providing integrative care. Obviously, we look at the totality of everything going on, but supplements will never correct a lifestyle issue.
Correct.
So if you're not willing to go to bed early, if you're not willing to adjust the stress, you could take all the ashwagandha.
You can take all the supplements you want, but we have to correct the infrastructure that's causing things like the cortisol to be fired every single day. And that's where things like meditation and cognitive behavioral therapy are going to come in. Mm-hmm. And in my opinion, I think this is the most profound research. And, yes, there's a nutritional deficiency. Yes, we'll take some vitamins and some minerals, but to take action, real action, I think things like meditation is probably going to be number one on my list.
So it's a combination solution.
Yeah.
Exactly.
And a lot of those lifestyle factors are free.
Okay.
That's exciting.
Let's just look at the studies real quick. Let's talk about this. So in terms of meditation alone, let's just look at meditation alone. So it improved digestion and lower things like blood pressure, and that was done at Harvard in 2007. It'll decrease the risk of heart attacks. This is just meditation alone. Help overcome things like anxiety and depression and anger and confusion. That was also done at Harvard. And it'll decrease things like pain perception for those individuals who suffer through fibromyalgia, which I'm sure you see a lot of. Increase focus and attention. And the most important part, which we mentioned, meditation will increase the size of your brain, which, by the way, which is the most important organ in the entire human body. Mm-hmm. And this was done again at Harvard Med. So huge studies to support things like using mindfulness, things like meditation to get yourself back on track.
Great advice at this time of year.
Yes, and so, this is, I'd like to wish everybody and all our listeners happy holidays and be safe during this holiday season, and try to consume as many healthy and nutrient-dense foods as you possibly can. Okay?
And Dr. Paris, where can our listeners contact you?
You can find us at thepoppyclinic.com. You can also look at my social media, Dr. Michelle Paris on Instagram. That's where I like to hang out, and you can come see what we're up to.
And Dr. Mike, let's remind our listeners how to connect with you and your team.
So AppleMed Clinic is at IGTV. You can reach us at www.applemed.ca. call us at 905-417-4000.
That's our show for this week. If you missed any part of Health is Wealth, go to our website, 1059theregion.com. I'm Tina Cortez. Thanks for listening.